Peter Corscadden is the name. I'm CEO at Oxipit. I've had a 25-year career in healthcare IT, from blue chips to startups, in services, in sales and product management, and I live in Belfast. A little bit about Oxipit, for those who don't know, we're an AI-first healthcare IT company, and we're bringing automation into radiology imaging. And chest X-ray that we're talking about today, we have 3 products that actually can work as a suite together, or they can work standalone independently. We have CT and MSK products as well about to launch, but we're most excited about chest X-ray today, obviously. And our chest X-ray solution is also pending FDA certification, which is hugely exciting for us. The company was founded in 2017 by a group of mathematicians and radiologists in Vilnius, Lithuania, where we're still headquartered. And we started off with a CAD product, a computer-assisted diagnosis style product called ChestEye. And ChestEye remains one of our cornerstone products, as you can imagine. We realized after a couple of years that the problem we're trying to fix isn't one of competency. No one is saying that radiologists suddenly don't know how to read chest X-rays anymore. It's a problem of scarcity. There's simply not enough radiologists given the growth in imaging volumes, as we've heard from the previous speakers. So in addition to providing that on-screen assistance through that CAD solution that we call ChestEye, we developed a solution called ChestLink. Now, ChestLink was and remains the world's only algorithm that's certified for the automated reporting of confidently normal chest X-rays. And that's just a different way of approaching the problem. So obviously it's looking for the absence of any pathologies, and it does so pretty comprehensively. So the algorithm is scanning for 75 different pathologies. And of course, the threshold, the sensitivity there is over 99.97%. So obviously it's operating at a very high sensitivity. So that product is taking care of the efficiency piece, right? So if the CAD side of our solution called ChestEye is looking after assistance and quality, then we've got the efficiency piece being looked after by ChestLink. ChestLink, of course, the beauty of that solution is that it's removing studies from the waiting work list completely. Nobody's clicking any buttons. It's just coming off the work list. So depending on the referral source, of course, that means that we could be taking away anything from 15 up to 40% of the work list away from that reading radiologist or radiographer. So it's a huge advantage, of course. And then thirdly, we have ChestQuality. And ChestQuality uses natural language processing. And again, it's working in the background as well, acting as an always-on safety net. So it's using natural language processing to scan all reports, and it's comparing them with the associated image, and it's flagging any discrepancy, either back to the reading radiologist or radiographer, or else it can also direct it into a different triage, a different work list queue, such as an emergency reading list. So these 3 products working together provide that overall solution. As I said, our goal is to automate wherever we can. So what about the benefits that brings? I guess, it stands up for itself. With that algorithm looking for 75 different pathologies, at that very high sensitivity, ChestLink is removing those confidently normal studies from that reading list. Nobody's clicking a button, which means that the patient gets an immediate answer. If that X-ray is clear, that's immediately going back to the referrer as a clear report. No further action is required. The radiologist, of course, gets a reduction in workload, which frankly is the #1 goal of all our solutions. The radiologist also gets a second pair of eyes, and the radiologist gets time back to focus on the more complex cases. Complex cases where we also have our ChestEye product working as a CAD solution with heat maps and templating as well. The radiographer, of course, in all of this, especially in countries like the UK, where we have a lot of radiographer-led reporting, they get automation of the triaging as well as the reporting. So full automation isn't for everybody. So plenty of our customers use our solutions just short of full automation, but they do take full advantage then of the automatic triaging. So that suits the workflow very nicely for a lot of the radiographer-led reporting workflows. So for any studies that fall below that conflict normal threshold, our CAD kicks in, and that's supporting those other radiographer workflows. And in the background, of course, that quality solution is picking up any discrepancies. So really, that's, in a nutshell, they're the three products that work together from Oxipit in chest X-ray. Where, again, I will stress the point, and several of our speakers have mentioned it today, we're not replacing radiologists here. We're just helping them tackle that burden of work that's crushing many health systems. So we welcome you, viewer, to evaluate any of these Oxipit solutions for yourself, and we look forward to hopefully hearing from you soon.